My name is Jo Boufford, and John Lang, Ambassador Lang, and I have worked with a fabulous planning committee to pull this meeting together. So I'd like to welcome all the forum members and speakers and participants. This is a little strangely shaped room, but I think we can all project and encourage you to use the microphone when we get into the question and answer period. And similarly, if you're on the panel or speaking, you'll be situated at one of these tables, so you're invited to find your name and have a seat. Let me give you a little bit of background. This is a meeting of the National Academy of Medicine Forum and part of the National Academies of Science and Engineering. And the overall goal of the Academies is really to provide evidence-based advice on health, science, and engineering for policy and practice, not only to government but also to policymakers as well as the public. This forum is a vehicle for bringing together individuals to tackle. It's one of a number of approaches that the academies use in their work. And I'm going to talk a little bit about this specific forum in a moment. But first, I want to thank the planning committee and ask them perhaps to raise their hands, who worked so hard to put this together. Dina Buford, who's over here in the corner. And I'm going to let you all take your applause because you deserve it. Jennifer Esposito, I haven't seen yet, but she may not. No. Renuka Gade, Trevor Gunn was here. Amy Lynn, Scott Ratson, Kathy Taylor, and Chris West. Kathy Taylor and Chris are here. We thank them very much, and of course the forum would not exist without our fabulous staff director Rachel Taylor and her colleagues Priyanka Nalmada and Katie Perez. So we thank them very much. This forum was really, I'm sorry, I've got some housekeeping here I'm supposed to do. This is a webcast. It's going to be a live webcast, and so we'd like you to mention your name before you make an intervention. And we'll remind you of that occasionally. There will be time for questions and answers and discussion after speakers and after each of the panels. And we last ask those of you that have name cards at your tables to please sort of turn them vertically, and we can see you so we can call on you to make an intervention. And others in the room that wish to speak, the microphone is there and available to you. The workshop is on the record, and a peer-reviewed proceedings of the report will be issued by the National Academies Press in the next months following the workshop. This forum was created to convene and develop a collaborative community of multi-sectoral global health leaders from industry and government, philanthropy, nonprofit sector, academia, professional associations, and other organizations of civil society, with the idea of leveraging their collective strengths and aligning goals to advance global health. And the special focus of this forum has been on the role of the private sector and its unique contributions, both in terms of really beyond resources. I think that's been one of the themes that's been developed here. Of course, the financial resources are important, but also the know-how and the intellectual capacity and infrastructure of companies around the world and what they can contribute to the partnership process. And we've been exploring a number of domains of that kind of partnership, and especially energized by SDG 17 really calling out the need for the private sector to be more involved with all international actors. The forum began in 2013. We have a number of different ways of working. One of them is this kind of meetings, these public meetings. We've had 8 of these, and then we've begun also having meetings for the members of the partnership to really get to know each other and really begin to have conversations about how different businesses, companies can work together, and it's often resulted in projects with other actors as a result of getting familiar. We can issue reviews of literature, also policy papers from our meetings, and policy papers have been commissioned on topics that have been seen to be important, and the proceedings of these kinds of meetings. We've also had several working groups that have spun off from the forum, and all of these things really happen because the members of the forum set the agenda. We don't set the agenda. They come together and really decide what are the topics that they see as the key ones facing them as members of this collaborative community in advancing global health. Since we began, we've had 26 representatives in our workshops from national, regional, and local governments across the world, 38 companies across industries such as food and beverage, telecommunications, extractives, financial services, medical devices, consumer goods, pharmaceuticals, logistics, cosmetics, insurance, aerospace, very broad arrangement, and also 60 experts from civil society organizations, academia, nonprofits, and philanthropy. And I think the important two really guideposts are reflected strongly in a document that was issued by the group a few months ago on SDGs, the private sector, and SDGs for health, which really speak to a broad definition of health, including health care, but the broader determinants of health, which are really by definition multisectoral and multidisciplinary, and similarly a commitment to engaging in partnerships that are country-led around country priorities. And this was heavily discussed here, and I think we felt it was quite a unique set of contributions in terms of the potential for guiding the work of the business sector in their partnerships. So with that, I'd like to introduce my colleague, Ambassador John Lang, who I must say conceptually has taken the lead in this area, which is something he works in 24/7, I think, for many, many years, talking about the financial transitions going on and looking for sustainable solutions. And we're going to be hearing more about the outline, and we hope to come up with many of those solutions by the end of tomorrow. So thank you very much for participating. John?
Thank you very much, Dr. Boufford. Joe and I have been very pleased to work with the Planning Committee and the National Academy of Sciences, Engineering, and Medicine staff to put this together, and we really hope you'll find this program very enlightening and productive. When I first started thinking about this, and others in our planning group started thinking about this, we were considering how the global health landscape is changing, and it will not be the same 5 and 10 years from now as it is today. You have transitions going on in so many different entities, multilateral, bilateral, country level, and at the same time, there's no magic coordination mechanism for these transitions. The starkest of these is something that I've been working on for years, which is the Global Polio Eradication Initiative. We all should applaud its great success. There were 350,000 cases of polio in 1988. There were 22 cases of wild polio virus transmission last year. Now, we all know that it's difficult at this point with the program and trying to deal in certain areas of Afghanistan and Pakistan that are controlled by the Taliban, and and trying to get to the last case. But we also know it's going to happen, and when that happens, a $1 billion a year global health program is going away. It will sunset, and we'll hear more about that later, about some of the specific plans for that transition. But that's just one of the changes that are taking place. You also have in Gavi, the Vaccine Alliance, and in the Global Fund to fight AIDS, tuberculosis, and malaria, transitions going on. And then you have in bilateral programs transitions going on, particularly as countries end up developing and moving into middle income status and no longer being eligible for development assistance from some of the multilateral and bilateral programs. And then you have changes in the burden of disease with an increasing focus on non-communicable diseases, and there will be the third United Nations high-level meeting on non-communicable diseases taking place this September in New York. With all of these changes going on, we really thought it was important to look at what those changes are, to understand this broader context, and then to look at ways to fill the gaps through efforts such as public-private partnerships and greater engagement of the private sector and many other mechanisms. So we'll be talking about those economic and programmatic transitions today and tomorrow, and we'll also talk about the innovative partnerships and private sector engagement to try to come up with sustainable support while maintaining and accelerating health gains, protecting vulnerable populations, and promoting health equity. Country ownership is a key to this, and we'll be talking about that, trying to focus on where in the end where it matters at the country level and at the community level. And the hope here is to develop some thoughts on sustainable solutions to this in the current global health context. Our program is planned so that today we'll talk about this broader context that I was mentioning. We'll first start out talking about the multilateral programs with a keynote from the World Bank. And later then we'll talk about some of the bilateral programs, the Development Assistance Ministry perspective, and then talk about the country level, as well as a focus today also on fairness in global health research partnerships. Tomorrow, we'll be discussing some of these potential solutions and hopefully have a lot of good, innovative ideas that will be coming to us in the discussions, including linking health and economic growth by elevating health on domestic agendas, shaping the market for investments in health, sourcing capital to catalyze and scale promising social enterprises, leveraging the core competencies of private sector companies, engaging industries in other sectors than the health sector, and advancing digital development and access for health. So we're trying to look at an array of innovative ways to deal with this changing global health context.